calling to order this hearing or roundtable of the Committee of the Whole of the Council of the District of Columbia. I'm Phil Mendelson, Chairman of the Council and Chair of the Committee of the Whole. Today is Thursday, October 8th, 2020. The time is 5:39 in the afternoon. I want to apologize to the witnesses because we were hoping to start at 4:30. I appreciate your patience. The subject of this roundtable is consideration of PR 23-723, Not-for-Profit Hospital Corporation Board of Directors Millicent Gorham Reappointment Resolution of 2020. When we noticed this hearing, we also noticed the appointment of a person individual to the Tobacco Settlement Financing Corporation. However, that person is withdrawing or has withdrawn given their work, which has changed, or their employer who has changed. So we are only considering the Not-for-Profit Hospital Corporation, and this is an appointment by the council, not a confirmation resolution. The stated purpose of PR 23-723 was to reappoint Millicent Gorham to the Not-for-Profit Hospital Corporation Board of Directors for a 3-year term. The Not-for-Profit Hospital Corporation operates the United Medical Center Hospital in Ward 8, which is a publicly owned hospital. The mission of the Not-for-Profit Hospital Corporation is dedicated to the health and well-being of individuals and communities entrusted in its care. And the purpose of this hearing, besides considering the resolution, is to gauge what community sentiment there is, if any, as well as to hear from the nominee. LaRuby May, former council member, is chair of the Not-for-Profit Hospital Corporation, and she has asked to testify, and we have the nominee as well. Perhaps both of you could turn on your video. I see Ms. May has done that. And Ms. May, are you ready? You want to give a statement?
Yes, sir, I'm ready. So good afternoon, Mr. Chairman. Thank you for the opportunity this afternoon to speak on behalf of Director Millicent Gorham. It was important for me, I've said many times before, Mr. Chairman, that one of the greatest privileges we have in life is to serve. And I get the privilege of serving on the board of United Medical Center. And one of the things that allow service to be significant is to serve with good people who are also committed and dedicated to the people we serve. And today I'm excited and thankful to have the opportunity to support the reappointment of Director Millicent Gorham to the United Medical Center Board. Her contributions to the board and to the community that we serve have been significant. Her commitment to specifically Black nurses and the field of nursing, and the way in which we deliver services for the people that we're privileged to serve at United Medical Center I wanted to be here to say that it's noticed and that we are grateful for her service. And again, that I fully support her reappointment to the board, Mr. Chairman.
Thank you, Councilmember. Ms. Gorham, do you want to proceed?
Thank you so much, Mr. Chairman. I want to thank you and the City Council for my original appointment to the board of the United Medical Center. I've been privileged to serve on the Governance Committee and the Quality Assurance Committee over the last 3 years, and I've learned a lot. I've learned a lot about United Medical Center. I've learned a lot about what it takes to run a significant healthcare system in Ward 8. The United Medical Center Board of Directors believes that it is an honor and privilege to serve the UMC community. Chairwoman LaRuby May reminds us at every meeting that everything we do, we must keep in mind the residents of Ward 7 and 8. Every decision that is made at the board level reflects careful consideration of the UMC patients, the community residents, and all UMC staff. The UMC leadership offers a critical data-driven strategic roadmap to get us where we need to go. I want to acknowledge the City Council and the Mayor's support for COVID-19 resources that helped to really significantly amplify what was needed in the community to make sure that the patients, staff, and the community residents stayed safe. We need, however, Mr. Chairman, appreciatively more financial resources for operations and to manage an aging physical plant. We need to make sure that everything that we do relating to UMC reflects culturally competent healthcare services that I know that UMC can provide. I know that UMC has the right amount of people to make sure that that happens, but we need to make sure that we have the right amount of resources to get the job done. Mr. Chairman, I think that my job within UMC to represent the nurses within UMC and within the city that we so much love, and particularly the citizens of Ward 8. I live in Ward 4, Ward 8, will only enhance what's going on in the community. And I want to thank the chairman for his consideration.
Thank you, Ms. Gorman. I want to thank you for your service since you were first appointed. So, Ms. Gorman, since you've been on the board, you have a sense of the time commitment that's required. I didn't check your attendance records, but can you tell me, have you been able to make all the meetings?
Mr. Chairman, I make all of the meetings for the board of directors, the governance committee, and the quality assurance committee that I serve on. Mr. Chairman, let me just say one thing about meetings and an aging facility. And this is one of the reasons why we need more resources, is because we've been having more than this year, more than any other years that I've served on the committee, on the board, emergency meetings. And those emergency meetings are related to an aging facility. Something goes wrong. And before anything can be done, any money can be spent, the chair calls a board meeting, an emergency board meeting. And I make those board meetings. And today I'm making this meeting, sir, while I'm on my vacation. And sir, I made the board retreat while I was on my vacation. That's how much I appreciate and privileged and honored to work at UMC as a board of trustee.
Thank you for that. And I didn't know I was disturbing.
That's okay. I'm glad to see you and talk with you, sir.
Yes, well, likewise, and that's the one of the values of Zoom. Now we have no break from work. So you're aware of the commitment and you are committed to continuing that.
Absolutely, sir.
I believe we sent you pre-hearing questions and
I responded back to those questions.
Yes. I haven't had a chance to look at them, but one of the questions was whether you're current in your taxes and obligations to the district government and federal government.
Absolutely, sir.
And another question is about conflict of interest. I always ask this, even though it's in the pre-hearing questions. In your service to date, have there been times when you've had to recuse yourself because of a conflict of interest?
No, sir.
Do you foresee that there might be a conflict of interest at some point?
No, sir.
And if there was, you would?
If there was a problem or a conflict of interest, my first obligation is to UMC, and I would go directly to the chair and let her know that, sir.
Okay. If it required recusal, you would recuse yourself.
Absolutely.
How would you describe relations among the board members? Does the board get along well or challenge?
The board gets along well. The chair sets the stage and the tone. And from my perspective, sir, she is a fresh breath of air when it comes to setting the tone, and particularly when it comes to the residents of Ward 8. Every meeting, sir, she talks about what she expects in terms of our assessment of the hospital and what's going on with the hospital. She relates it right back to Ward 8 residents. And so that's how we follow that role. She's the role model, and that's what we follow, sir.
Now, she's not asking you to ignore Ward 7, is she?
She pretty much sticks with Ward 8, sir.
Okay, well, I think the hospital should be paying attention to Ward 7 too, but I also, 7 as well, but I also think, but this may be with the new hospital, that we want a hospital that's attractive to residents all over the city. Is the board involved with any of the discussions over the new hospital?
The board is involved with, from a very basic level in terms of the new hospital. But what we spend most of our time on is making sure that the hospital that exists now provides the best services that it can with the resources available to it.
Because we are trying to move forward, but I'm thinking here, we've got the money in the budget for building the new hospital. We've approved the agreement for operating the new hospital. And so the board is being kept abreast, but at a more basic level.
Yes, sir.
You'd mentioned the financial resources, but I don't know, well, we don't have a budget before us right now. And even if we did, we've seen declining revenues. I don't know what more we can do there. Is there not a representative of the chief financial officer on the board?
Absolutely, sir.
Is that a helpful presence?
Absolutely.
Okay. One other question I have is, you gave a statement, but I don't think we have a copy of it.
The statement is in the letter that I sent over with the questions that I responded
Okay.
to.
Okay, we will look for that. And Councilmember May, I don't think we have a copy of your statement. If you could provide that.
Yes, sir.
Thank you. Is there anything else, Ms. Gorham, that you want to add with regard to observations about the hospital?
I think I've said it all, sir.
Okay. Well, I appreciate your service, as I said before, and your willingness to continue to serve as one of the council's nominees, or appointments, I should say, to the board. If there's anything else that you want to provide, the record will be open for 2 weeks. That is 5 o'clock on October 22nd.
Thank you so much, sir. I appreciate the opportunity to talk with you this afternoon.
Likewise.
And I also appreciate Chairwoman LaRue May's confidence in me as well. Thank you.
Oh, no problem. Thank
And
you.
And you're having said that, I still feel a little guilty that I kept you waiting for over an hour, but.
Well worth it, Mr. Chairman. Thank you.
Okay, thank you. Thank you, Ms. Gorham. Thank you. It's good to see you, LaRuby.
Same here, Mr. Chairman.
And with that, this hearing or roundtable is going to be adjourned. It's 5:53 in the afternoon, and this roundtable is adjourned.